Do you have a saggy, pouch, puffy eye area, or wrinkle? Yes, I'm gonna show you in this video how to remove all that problem. Let's get started. Thank you for coming Spa at Home. So I'm going to show you the muscle right here, and we're going to do a treatment around the eye area, which is like a ring shape around the eye, orbicularis oculi. So this muscle is using for closing open your eyes, and then they work more than that because they attach in so many different muscle around the eye area. So it's sometimes overwork. So I'm gonna show you how to massage, increase the blood circulation, and then increase the lymph system. So let's start it. Mostly people concerned about eye area. That was the most requested video I have to make. So around the eye area, under eyes, always like a puffiness, and then the pouch and droopy, and then also the upper area too. And the wrinkle is the most hated parts we have, which is, we can remove it or we can reduce it. So once you get deeper wrinkle, it is kind of hard to remove it, but we can reduce it and then prevent it. And one of most important parts is usually around the eye area connecting the kidney. So if someone has a weak function or overworked kidney, and then also, someone get inflammation all the time, having problem all the time, that cause a lot of problem too. So pouch, saggy, and then dark circle around the eye area, that usually connecting with the kidney. So you can think about in and out, like, water balance, how much you intake and how much it's going out. So if you have an unbalanced situation, sometimes that causes a lot of problem because the whole body is going to be puffy. And then also you have a lot of friction going when you're removing your eye makeup. You're kind of like, abusing around the eye area. So that might cause a lot of problem too. So I'm going to show you how to reduce all the problem. So I'm going to use the grapeseed oil, which is, I've been using it for the last few videos. So this oil, you only need a little tiny bit, or you can use the, leftover sheet mask. There's a lot of serum. Or you can use eye cream or eye serum to use it around the eye area. So you only need a tiny bit, and then apply the nose and the eye area. So you don't need to pull or push. Make sure you can just make it dots with your fingertip so you don't stimulate way too much. And then to the temple, okay? And then we have to know where the temple is. So make sure you know where is your pressure point is. Okay, so we have to go to the temple and then coming back from the temple. And then make sure you don't do friction or pull in your eye area, because around the eye area is a thinnest skin and the whole body, maybe one tissue thick. So it's very gentle and a very thin. So making sure you don't do friction or pull and, like too much friction is going to cause a lot of problems. I'm always telling my clients, when you massage around the eye area, you don't want to push too hard. You don't want to have a pressure way too much. So I recommend it to use the ring finger because they're not really strong like point finger. So use that ring finger to massage around the eye area, so it doesn't friction too much, or it doesn't pressure way too much. And then there's a under the eye area, there's a lot of pressure point, so you can use the fingertip. So starting from the nose, and then put your fingertip, two other pointing and the middle finger on the bone, not inside. So there is a bone around the eye area. So go up, press release, move, go up, press release. So you don't need to slide it. You can just move your finger, pull up, move it. So press, 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 press release to the temple. So you don't need to way too strong. You only need a little tiny bit. So make sure gentle, press release to the temple. And then now you can start it from the temple and coming back in inner side of the eye socket, which is a little inner side for bones. So it's not on the bone, but it's like an edge of the bones. So you can just go in close to the under eye. So you don't push in, but you just kind of slide gently. Don't pull your skin, gently. And then attach right next to your nose. There is a lymph knot. There is a little dents under the eyebrow. That's the eyebrow. Yep, you can start it from the fingertip. Maybe on the second joint, you can just attach it right there. And then I want you to feel the dents under the brows. So that's a lymph knot, and then also that vein is going back and forth. And pretty much you put your hand at the head on your finger. Your finger not pushing your head. Pretty much your head is like using it as a pillow, your fingertip. So you can put your heads on the fingertip. So it gives you great pressure. I hope you understand what I'm saying, but making sure you just giving a little bit of pressure right there. Press release. So it gives pumping motion. So help increase the blood circulation in the lymph. And then now you can use the middle finger, and the brow is gonna be between your ring finger and the middle finger to grab in the brows. Then the ring finger goes on the bones. Okay, it's not inside the eye. So it's follow your eyebrows. So it's gonna be go around the eye area, but your ring finger have to be on the bone. Okay, not inside. And goes to temple and to the finish at the temple. And then make sure you are not massaging the eyelids that close the lashes. You're massaging and then stimulating lymph. And then there is a frontalis, which is big muscle, is attaching the orbicularis oculi. So, it's moving together. They're attaching together. So making sure the middle finger parts is stimulating the attaching parts. So let's do the both sides. And then also, if you don't understand what I'm saying or how to do it, my finger is the right place or it's not. We can do that Instagram live too. So let me know, DM me, making sure you understand that. So now you can place the 3 fingertip. Let's go, start it again to the temple. And use the ring finger to go in. And place your ring finger right next to the nose, under the brows. Make sure you feel the dent. Okay, use that fingertip. Then put your heads on the fingertip, pressure and release. And then use the middle finger to grab the brows, and then go over the bone. Okay, not inside the eye socket. And then end up the temple. So now is the last things I would like to show you. You want to do, DePuff, and then, if you want to relax around the eye area when you have a makeup on, what should I do? Yes, this is how you're going to do. It's easiest, and then pressure points, stimulating the muscle, increase the blood circulation, and then lymph. When you see, when you're watching a movie, computer, your phone constantly, sometime, your eye area is to start twitching. That's pretty much telling you, your body telling you, I am overworking. Hello? So this is the treatment. You only need 1 finger or just a fingertip. So make sure you clean your hands. And then if you're at the desk, put your elbow on the desk and then use the thumb to bend it, your thumb, and then place under the carb, under the eyebrows. If your fingertip, thumb doesn't bend it well, and then you can find the surface, like a hard surface, is the wall or anything, for your elbow, and then place your heads on the thumb. So pretty much like I showed you before, your head's resting on your thumb. And press and release, press and release. So if you keep doing like maybe 5 to 10 times, this is going to be refreshing your eye area, and your eye is going to be circulating. Or you can just grab like that, but I just don't want to have a wrinkle in between the brows. So if it's working for you, you can do it, but for me, I like press release with the thumb. So make sure you put your head, so that gives you good pressure. So press release. And then make sure you wash your hands and clean. Make sure you're clean. And use the fingertip to just lightly goes inside to outside the temple. And then a little bit tapping. So that tapping helps removing the lymph system. So reduce the puffiness. So this is the easiest. Whenever you are, you can do this treatment for you. You can do it in the elevator, you can do it in the bathroom. When you watch it, when you look at the computer screen, you can do that too. And then also you place your three finger under the brows and pull up. So you make sure the upper side of muscle is pulling up, and then release. Pull up, release. And then also under the eye area. So make sure you don't do friction, you don't rub it. So it helps the eye area to reducing the wrinkle, saggy, droopy. So the collagen production is going, so it's going to be tightening, and the younger looking, bright eye area. So a lot of my clients are always asking me, what kind of eye treatment should I use? I always recommend it to, for them to use water-based serum. And I'm not biggest fan for the eye cream. So if you're really moisturizing in the hydrated eye area, you can use the serum a lot and then moisturizer after, which is a thin layer. And if you remove in the eye area like an eye makeup, make sure you don't pull. Use a soft cotton or tissue to remove it. So you can place the tissue like that, and then you can wipe slowly, but not pulling, okay? That causes a lot of problems, so be gentle. I hope you enjoy my video. So last things I would like to talk to you about is there's nothing right or wrong, but the friction and the rubbing and also the heavy eye cream, it's not gonna help your eye area. Because I show you this few picture, someone who has a little white dots around the eye area like this called milia, which is mostly time people using a heavy cream or something your skin doesn't want it. If it's too heavy or anti-aging cream, so that causes a lot of sebum to stay under the skin, but there's no pore, so they can't remove it. You have to go dermatologist to remove it. So around the eye area is a very gentle. So make sure you use like a little bit lighter than face. You can use a different kind of serum, different kind of like a water-based cream, not too heavy. And then if you stop using heavy cream, what you're using right now, the milia is gonna be like disappear like 3 to 6 months. So if you have a lot of milia around the eye area, you have to consider, or sometimes you might not using anything. So the sebum is overproducing. So that might happen. That time you can use the serum. Make sure you hydrate around the eye area. So it's gonna disappear, slowly disappear. It's not gonna be disappear all at once. One by one, it's gonna be disappear. But biggest one, you might have to go dermatologist to remove it, physically remove it, so it helps to reduce quicker. So when you apply the skincare, make sure you don't do friction way, you don't rub it. You can just slide nicely and press in your skincare. You can use your fingertip to press in. Okay, so like that. Make sure you do gentle around the eye area. I hope my tip and massages help you today around the eye area, so you can reduce all your concern and the problem. But thank you so much for watching my video today. I hope that you enjoy, and if you have any questions, just let me know. Thank you again. Enjoy me care. Thank you for watching Beauty Elements channel. Don't forget subscribe and then follow on the Instagram.